actually going to have you do your signs before you come in, otherwise you would do that as part of your assessment. So you're going to come in also and identify yourself. Hi, my name is Diane. I'm your nurse today. Can you give me your name and birth date? And you're going to identify your patient, check that with the wristband. And you can check his orientation by, asking him. You've already gotten his name. Does he know where he is? The time, person, place, and time. So then, I've already kind of gotten a little bit of an idea just by quickly talking to him, and I'm taking in information with his face, his skin color, kind of comfort, how he is in the bed, any trouble breathing or anything obvious like that. I can also take a look and notice if he has any jugular vein distension. And I'm going to, can you turn your head this way for me, please? Thank you. I'm just going to do a little assessment here. So I'm going to palpate the carotids, one on each side. And then I'm going to have him hold his breath. And I'm going to auscultate the carotid. When I palpate, again, you're going to start at the jaw here. Down, having him hold the breath on each side. And when I'm listening or palpating the carotids, I do one at a time. It's the only exception because the other pulses you want to do at the same time, and you're comparing from side to side. And then his pulses are normal. They're 2+ on either side. So I'm done there. I'm going to bring this down for his anterior chest. I'm going to listen to the heart. So I'm going to start the second intercostal space on the right. I have listening to the aortic, pulmonic, tricuspid, mitral area. I'm going to stop here and take his apical pulse over 1 minute. I'm noting whether the rate is regular, and I can count. So I have my minute, and I can flip it to the bell, and this is where I'm hearing S1 the loudest. Flip it to my bell, go back over. I'm going to add a spot there if you're listening for murmurs. And up here at the base is where I'm hearing S2 the loudest. I can also check now I'm moving on to the lungs. If I want to get the respiratory rate, I can just leave my stethoscope on here if that's how I want to count the chest rising and falling, or I can just observe. So I want to know his respiratory rate and note the depth. And I'm going to have him, can you take a deep breath in and out for me, please? So I'm going to start at the apices and listen in and out. There's a picture in your book. You're going to compare from side to side, coming down like the mid-clavicular line. You're also noting it with the chest. Any lesions, any abnormalities, any lifts, heaves, masses. And you can do chest expansion. Can you take a deep breath for me? Okay, and I'm watching how that expands on both sides. So I have his anterior chest. Then I'm just going to come down, taking a look at the skin on his arms. Okay, noting any abnormalities. I'm going to come down, feel for the temperature. I'm going to take his brachial pulse, compare from side to side, and grade it. Down to his radial on both sides, and grade it. And then I want to inspect, checking the skin everywhere. Okay, I can check for capillary refill on both sides, and also I'm going to check the profile side and note the angle. Okay, just checking for clubbing. And I'm going to move to his abdomen. So I'm going to do my inspection, noticing any changes in contour, any masses, pulsations, bulges. Is it flat, protuberant? If I note any distension just visually, looking to see if there's any scars, bruising, lesions of any kind. And then I'm going to auscultate, starting in the lower right quadrant, moving to the upper right, upper left, lower left, listening for the bowel sounds, noting if they are normoactive, hypoactive, or hyperactive. And then I can palpate, see if there's any distension, any tenderness, if there would be any tenderness. And on the opposite side, I could do rebound tenderness, where you depress and then withdraw your hand. He doesn't have any, no pain. Just checking the skin around everywhere. And I can palpate his femoral pulses here. And again, grade them, compare them side to side. Noting the skin here. Okay, then the same thing down the lower extremities. I'm taking a visual look from side to side, noting any lesions, discolorations, hair distribution, checking the skin. I'm just going to come down, checking the temperature. I'm going to feel the palpatile pulses, grade them. If you can't feel them, you can't feel them at all on these mannequins. We're just checking that you know where to look. But in real life, if you can get the pedal pulses, it's going through the popliteal area. Then I can finish with my pulses, the dorsalis pedis, posterior tibial. And again, compare them to one another and grade them. I can check capillary refill. And I want to examine the skin, the bony prominences here, make sure there's no open areas, looking for any edema, if there would be edema. I can grade that if it's unilateral, if it is, note if it's pitting, non-pitting. If I have just edema in one leg, to compare, I could go ahead and measure that. That would give me a real objective measure. So I'm done with his anterior side then. I can have him roll on his side then. I'll roll you over. I'm going to listen to his lungs in the back. And then I'm going to start up at C7 up here at the apices. Listen from side to side with each deep breath. You want to come around the scapula. Okay, so listen to that, and then I want to check his skin again through all areas, and that looks fine. Now, he didn't have any wounds, but they might have a wound, and if they do have a wound, if you remember, you want to take a look, you want to note the length, the width, if it's open. the depth by measuring with something else. If it has sutures or staples, you can count those. You want to note if it's approximated. If it's open, you want to describe the wound bed. You want to describe the peri area, the area around the wound. You wouldn't be able to tell here, but you want to describe any drainage, which you kind of be noting with the wound bed. But if you were actually changing a dressing, you'd know the odor and any drainage that was on the pad. Okay. That didn't take that long. Let me see if there was anything I forgot.
I have a question of the musculoskeletal.
Yep, that's it.
And the